Let me ask our panelists to turn their cameras on as we get started here. Uh, Everyone, thank you so much for joining us today. Welcome to our webinar. We're really pleased to have this group. I know that the numbers participants continue to grow here. And as I see people introducing themselves in the chat, it really is an indication to me that this is what Core Group is all about. People joining from all the different regions of the world here to really get into topics and share information and perspective just like this. This is the value that Core Group provides organizations around the world. And we're really pleased to bring this discussion to you today. My name is Stephen Ram. I am a Core Group board member and Senior Director of Global Health at DAI. We're so excited to have you and to have the opportunity to convene and contribute perspective on this important and very hot trending topic right now. By design, we have a cross-section of remarkable individuals from remarkable organizations from global to community-based that we believe are going to really provide some interesting and actionable insights for health and development practitioners. We're going to start today with some opening comments from Core Group Executive Director Lisa Hilme. And then we're going to segue into introductions of our panelists and into our main discussion. We'll then have a question and answer period. If you have questions at any time during the discussion, please put those into the chat where you are introducing yourself now. Our colleague Caroline Quijada from Apt Associates is curating those questions, and she'll be feeding them back to myself and Lisa and the panelists so that we can then answer them after we've concluded our discussion around some of the key strategic questions that we have for our panelists. So with that, let me hand the mic over to Lisa Hilme, Executive Director of Core Group, for some opening comments. Lisa?
Thank you, Stephen and Caroline, for your leadership and planning. This is really exciting to see South Korea, Germany to Brooklyn represented, as well as Peru. So thank you all for attending. I'm so grateful to Stephen and Caroline, who are members of our board of directors at Core Group, who have assisted in this planning and thought leadership. So very much thank you. I have a great board of directors. Thank you, Lydia Bologna from Core Group, assisting with Zoom today. As Stephen said, my name is Lisa Hilme. I'm a nurse. I'm a public health professional, and I've had the privilege to work with this amazing team at Core Group and with all of you as members for over 7 years. So we're very grateful to our speakers today and you as participants that will join this very important conversation on localization. And for the past 3 years, Core Group has led a series of conversations on localizations, decolonization, the shift in language that we need in global health work, deconstructing power and race in global health, as well as agency and empowerment of our country-based partners and Core Group members. And how do all of these contribute to access to healthcare and health equity? As a membership organization, Core Group wants to ensure our members have opportunities to share their perspective, to access conversations with donors, as well as funding, opportunities, and other resources. We're very happy today to continue this conversation, and we look forward to hearing from all of our panelists on their thoughts and experiences, as well as all of you. So I can see you're all introducing yourself, putting where you're from. Please also add your comments as the conversation continues, your questions. We want this to be very interactive, and we're at over 100 people right now. So we know it will be a rich conversation. For 26 years, Core Group is promoted and we've worked with local communities to improve the health and well-being of women, children, and adolescents, especially for those underserved communities. We've embraced engagement with local communities in their decision-making, their planning, and implementation of the health interventions. So this conversation today on localization is not new, but we are advocating for more action and diversity of thought to inform policies, resources, and representation. In an ever-connected world, we really recognize that sustainable change and effective solutions can only be achieved when they're specific to the needs and context of the individuals and communities, all of you on this call, as well as our panelists. Localization doesn't imply this isolation or neglect of global cooperation. And maybe on the contrary, it emphasizes the need for collaboration between local, national, and international stakeholders. And so we know that the global health challenges demand collective action, expertise, resources, and knowledge sharing of all stakeholders, and it plays a crucial role. We recognize how different donors approach localization, and this also affects the way of operating in the global health environment. And so we see this conversation today is very important, and we are sure it will yield some rich and meaningful perspectives and opinions. We want to ensure your thoughts are captured, and we will inform action and change, not only in the organizational infrastructure, but also in the policies and hopefully donor mechanisms. So I thank you again for your participations. Put your comments and questions in the chat box, and over to you, Stephen.
Thank you so much, Lisa, for those thoughts, those comments, and that good guidance on how to make this a very effective webinar here. So let me proceed with introducing our panelists. We're really pleased to have all of you, and thank you in advance for your time. Mr. Adan Wako is the Regional Director of the Africa Social Development Focus. He's a seasoned development practitioner with 27 years of experience working in international, regional, and local organizations, particularly at the Kenya-Ethiopia border. Adan holds a diploma in animal health and behaviors and a bachelor's of science in applied community development, plus an MSc in agricultural communication, information, and management systems. African Social Development Focus is a development and resilience building organization that empowers communities through sustainable, community-driven development interventions in both Kenya and Ethiopia. Welcome, sir. Thanks for being with us. Dr. Yusuf Daoud is the Chief Operating Officer at Africa Human Capital Development Plus. Dr. Daoud has overall operational responsibility for the organization's management, operational strategy, optimizing resources, processes, and people improvement. He has 25 years of leadership and management experience leading operations across Africa and Southeast Asia. Dr. Yusuf holds a PhD in organizational leadership from Pan-Africa Christian University, an MBA from Kampala International University in Uganda, bachelor's degree from Cambridge International College in the United Kingdom, and a diploma in agricultural engineering from Jomo Kenyatta University in Kenya. He's a member of the Kenyan Institute of Management and the Kenya Institute of Supplies Management and Next Level Purchasing Association in the US. Welcome, sir. Mr. Isaac Ntwiga is the head of programs at the AMREF Institute of Capacity Development. Isaac is a public health expert with 15 years of experience leading and providing technical oversight in health system strengthening and integrated public health service delivery programs in various countries across Africa. Over the years, Isaac has worked with diverse teams in multicultural and rapidly changing implementation environments, engaging with governments, private sector, and multiple stakeholders in last mile communities. Isaac believes in institutionalization of interventions for development of self-reliant and resilient health systems that strengthen local communities and institutions to be a catalyst for people-centered health investments. And Kelly Saldana is the Vice President for Resilient Health Systems at Apt Associates. She has 25 years of experience in international development and health, most extensively in health systems and health system strengthening. Kelly worked in many regions of the world while serving in senior roles at the U.S. Agency for International Development. She's worked with public, private, and nonprofit sectors and communities and represented USAID on interagency and international advisory committees and expert groups involving health system strengthening. At Apt Associates, for the past year, she's been supporting systems and thinking efforts across systems thinking efforts across the portfolio, including Apt's approach to localization. Welcome to all of you, and thanks one more time for being with us today. I want to get started and jump right in so we can maximize our discussion and Q&A time here. I want to turn to Kelly first. And as I mentioned in the beginning here, we've got a cross-section with Africa Social Development Focus as a community-based organization, a cross-section from global to very local organizations here by design to really get a rich perspective across that range. Kelly, starting with your perspective from a global organization and perhaps things that you gleaned from your time at USAID as well. How is APT as a global prime recipient organization integrating key principles that you think serve localization into your partnerships with local organizations? And what are some of the challenges and best practices that are emerging for you?
Great, thank you. Good morning, good afternoon. I see some of you are calling in from very late in the evening or very early in the morning, so it's wonderful to see so many different people on the call. And just to start out, before I answer your question, just to recognize that I think from our position as a global organization, APT tries very hard to be in learning mode and to sort of respond to the needs and perspectives of our partners around the world. And so I am hoping to do that on this call today, to learn from my other panelists and hope that you will all challenge anything I have to say that you disagree with. But to answer your question, I think one of the biggest challenges that we find in localization is that a lot of the conversation has been directed primarily to focus on the piece of localization that is funding directly to local organizations. And from the APT Associates perspective, that is a very important aspect of localization, but it is also a very narrow view of localization. And we understand that USAID takes a much broader view to localization, and we're trying to take a broader view of localization so that we can embed it throughout our work. And so a couple of examples of that, APT has supported health system strengthening and system strengthening work for many years. Systems thinking is a key aspect of localization, trying to make sure in anything that we do that we are bringing in a wide variety of perspectives into our work and really analyzing and understanding problems by listening to the communities that we're working with, everyone from government to private sector to the local community and their various differing voices, and trying to position APT in a way that we can provide forums for those voices to understand them and to help integrate them to really move forward on health systems around the world. I think the ways that we are trying to provide technical assistance also are reflective of localization, where we try to go in not as global experts, but more as facilitators of local expertise. And so trying to understand through the projects that we implement how we can be supportive of local partners, how we can respond to the needs that they identify, how we can help source expertise if we don't have it at APT, or if there's something specific that a local partner needs, where we can identify that expertise and bring it to them and help them to get the expertise that they may need, look for, or identify. Across that, though, I do want to recognize that those basic principles of localization, of sort of the way we're providing technical assistance and taking a systems-based approach to everything we do in localization, comes across in lots of different ways. So everything from the staff we hire on our projects. So although APT is a global organization, we implement projects around the world, and we're really trying to reduce our dependence on expatriate staff from the US. So over 99% of our in-country staff are either local direct hires or third country nationals. In particular, on our vector control programs, which we've implemented on behalf of USAID's PMI program, for several years, we have mobilized an entire ecosystem of African scientists who are experts in malaria control. We have several local hires who have been with us for 10 or more years and who have really advanced and developed their own individual capacity through those programs. We implement localization as well through grants programs. So we, through lots of our global mechanisms, we issue sub-grants and local grants, and recognizing that the grants programs manifest in lots of different ways, everything from small grants that provide seed funding to community-based organizations, to public-private partnerships which mobilize resources that have staying power within local countries. So for example, we implement a health facility electrification and telecommunications alliance, which is a global alliance that's really trying to create public-private partnerships of global actors to electrify health facilities in Africa in a lasting way through those crowding in of private sector resources. So that's another form of localization. There's also grants that we implement that are longer term or that are more specifically related to their programs. We support local organizations through subcontracts under our projects, where we try to identify local organizations to implement the work that we're working on. And then I think, again, moving back to our systems thinking and our technical assistance approaches, we try to seek out awards where we're working with and through governments to enhance their ability to implement health systems. So we've worked with Vietnam to support domestic health insurance. We've worked with Colombia to adapt its health system to be able to support Venezuelan migrants into Colombia. We are working with USAID in Senegal to provide the operational support to USAID's global or government-to-government mechanisms within Senegal. So really looking across all of the different ways that USAID provides assistance, how we can help with that assistance, and trying to infuse a broader perspective of localization into everything we do, and really thinking about it beyond just a very narrow definition about funding to local organizations. And I will stop there because I know we want to get into a very rich discussion.
That's great. That is a great start to a rich discussion, Kelly. Thank you. I'm hearing systems thinking is key. It's key to ensuring that you're thinking broadly about ways or points of entry to improve or increase the voice and the involvement of local voices and actors that should be driving this particular moment, perhaps among other opportunities in more locally led voices leading and prioritizing the way development dollars are being spent and accessed, et cetera. So that is all really rich stuff for us to flow into the rest of this conversation. I want to turn to Isaac for a moment at AMREF. Isaac, AMREF is very well known. It has had I shouldn't say quick growth, but it has certainly had tremendous growth over the last several years that I have enjoyed watching and partnering with at different opportunities and moments over the years. Being now a direct recipient of USAID, whereas earlier in the organization, it was more recipient of local funds and through partnership. How do you think organizations need to prepare for leading the development agenda going forward? Picking up the thread from Kelly there about increasing the voice, increasing the presence, and giving space for local organizations to take that lead. What do organizations do to need to be prepared for leading the development agenda in their countries and communities?
Yeah, thank you, Stephen, for that question. And yes, you're right. AMREF has been around for now 65 plus years, aging gracefully, but also taking a lot of lessons from these conversations that you're taking on today. And picking from where Kelly finished around what is required to be done and what really global organizations like us are doing. From AMREF's side, we've been here and we've learned quite a bit in terms of partnering various, funders, like you said, like USAID, where currently we would say we've grown to be a direct recipient of USAID funds. But through the years, like I've said, many of them, we've taken lessons, we've learned, and we've documented those, and we've gotten to a place where we are also sharing with others that are coming very fast behind organizations like ours, in terms of what we think really makes us ready to lead the development agenda in our countries, in our communities, and I would add in the continent, of Africa. And I would like to share probably about 5 or 6 things that we think, and I really embrace those, that organizations need to be prepared to have. And one of those, is to have very sound organizational leadership and governance. As much as we are saying that we want to give, more responsibility, to give more work, to partner with local organizations like ours, the glue that puts everything together is very sound leadership and governance for these institutions, because this is what will preserve and strengthen stakeholder confidence and provide, the foundation for what I consider to be high-performing and accountable organizations, that are local, are led locally, and are implementing programs locally. And the second thing that I think organizations need to have is operational excellence. And you don't achieve that overnight. Something that you nurture, that you grow progressively over time, and certainly with the assistance of others. So this one will help the local organizations to be very progressive in decision making and very progressive in terms of the operations that they embrace, to ensure that they are delivering value for money. For example, for us, where we are within the health sector, we ask ourselves, how much health are we able to deliver, for $1, for €1, operational excellence that makes sure that we embrace and work on environmental sustainability. Because we don't work on that, and we don't make sure that our programs are operationally excellent to embrace that, then eventually they won't be sustainable. And more so, being bold enough to be based in the communities that local organizations serve. And I think that's one of the things that drives what we do at AMREF, that you don't want to be based at a distance. You want to be based there so that you're able to work with them, co-create with them, measure success with them, define success with them. And the third thing that I think is very important, I would call is technical excellence. Of local organizations like ourselves, African organizations, indigenous organizations, when we were being conceived and thought about and established, there was the big idea. There is what, the founders and current people working in the organization have as a dream, the vision and the vision. However, that cannot be delivered unless we build the technical capabilities that embrace what we want to do, that allow us to be able to address the community, the country, and like I said, the continental health agenda. So that technical excellence allows evidence-based, delivery of programs. And once a local organization then is technically sound, then they are bold enough to hand over technical leadership to sub-levels. For example, a local organization which is very well established, able to work and even transfer some of the work they are doing to other local, counterparts, and then because of their technical excellence, provide some technical assistance so that they can also grow and achieve that technical excellence. We think about, when we look at this at AMREF, that this is very, very important. Now, as we go local and we localize and we make sure that local institutions, local organizations, community-based organizations are receiving resources to address the community needs. A fourth thing that is very important is being able to develop a resource mobilization expertise. You realize there are many types of resources. Some may be financial, others could be kind, others could be mobilized the communities themselves to see what they're able to do by themselves to address the issues that they have. So the ability to build on emerging opportunities, ability to address external, resource challenges is very critical for the localization work to be, agenda to work. And anybody advancing this should be able to have this in mind, because any local organization delivering competently, then we'll need to set out a very clear path to establish and consolidate, sustainable funding streams. And the other one is that, and I think Kelly mentioned this, is that a local organization has to be a learning organization. has to be ready to learn and deliver in a very rapidly changing environment. It could be digital pollution, it could be climate crisis, it could be, for example, in Africa, where we know that the youth demographic is big, is rising rapidly. You know, there is a lot of urbanization, conflict in some areas. A local organization needs to be very adaptable to be able to learn and be able to deliver this. And finally, for me, the sixth thing that I think is very important is even as we do this, a local organization to be able to function and deliver and sustain, you know, its impact, there has to be the willingness to embrace diversity, embrace equity, embrace, you know, inclusion, and even today at AMREF we are talking about belonging. So that we have to recognize that any development, including health development, cannot be achieved without embracing those things, and make sure that diversity, equity, inclusion, belonging is mainstreamed within the organization itself, within the program designs, within the implementation, and recognize, you know, the role of all players, whether they are women, whether they are youth, whether they are special groups, and not just as beneficiaries, but as agents for the change that is required, you know, and embraced by those organizations. So for me, I think those are the thoughts I have around what a local organization needs to prepare for them to be a leader.
That's wonderful. I mean, that is the outline of a toolkit, of a book even, to really provide some stepwise thinking for how to structure an organization to continue to increase their leadership role. Dr. Youssef, being the chief operating officer on this panel and having that role, I heard things here from Isaac about operational excellence, but balance with their ability to provide value for money through evidence-based delivery of projects and social impact. I heard a lot of other things from Isaac as well, but because that is right there in the bio that I just read about you, I'd love for you to maybe comment on that further, that finding that balance between operational excellence and reliability and the ability to deliver while also learning and adapting for an organization. What comments, thoughts do you have about that from your background and the different organizations that you've worked with over the years?
Thank you very much, Stephen. I think I have listened to Kelly. I've also listened to Isaac. Very interesting, insights and submissions. Two things I wanted to add. Number one, on Kelly, I think she talked about a number of principles they have been using to advance integrate localization in their programs and partnerships. And one thing I wanted to highlight was, which could be a challenge but also an opportunity, is the strategic nature of localization. Looking at the need for strategic nature of localization. Sometimes we realize that we don't look at sustainability of partnerships, especially when we discuss localization. And what usually happens is we think short term, and what I call marriage of convenience, the hit and run kind of partnerships, which is very much around discussing what kind of partnership we need to have over funding issue, and then once the project's over, then that partnership ends. So what we need to look at as a principle and probably a practice is thinking long term with local actors without really looking at the short nature of a project, but then thinking broadly, ensuring that we're able to make strategic investment like multi-year funding, covering the full cost for partners, investment in capacity of partners, so that the partners are ready in the short as well as in the long term, and they're able to really respond to current issues as well as prepare the capacity to respond to probably future needs. So that is one I just wanted to add on Kerry's. In terms of the comments by Isaac, I think it's very important from an operational perspective. As an organization, we receive funding from different sources, from multiple donors. And it's important for us to be able to really balance the need to judiciously manage those resources, but also ensure there's impactful results at the end of the day. So it's important for local organizations to have that capacity financial management capacity, technical management capacity, the human resource aspect of that, to make sure that not only are we able to manage donor resources or whatever resources that we get from our funders properly, but also ensure that we're able to get value for money as we deliver goods and services, and also ensure our programs are able to deliver high quality and impactful programs. So that is what I will add on that aspect, Stephen.
Sorry about that. I was muted still. Adan, I want to turn to you and your perspective from a community-based organization working across a border, working in rural and remote areas. Some of those points about short-term funding. I mean, the issues that an organization like yours deals with are entrenched long-term issues that require longer-term thinking. And some of what I'm hearing from Yusuf and Isaac before him and is really about how sometimes the nature of and the structure of how development dollars come about can be part of the problem in some ways. What ways would a community-based organization like yours prefer to work, especially capturing this moment? If we have momentum toward locally led development and localization of development dollars, how can a local organization really sort of capture that momentum? And what ways would best suit a community organization like Africa Social Development Focus?
Thank you. Based with our experience as African Social Development Focus, we have been engaged in several programs with funding from international organizations through their donors to us. And one of the things which we can say as a localization, in our terms, localization to us is make things as local as possible and international as necessary. Simply because why I said international as necessary is to build the capacity of the local agencies, because we need investment in strengthening the capacity of the local agency so that they are going to see the value for money, and also giving direct and quality funding to local agencies will going to strengthen the localizations and make end goal to meet. We also, based with our experience, one of the challenges we are really facing is issue of indirect cost recovery, where when we back through international organizations, we are only given some few percentage which will not even sustain the organizations. And even in terms of operation and partnership, it will really make a big challenge. So we found it better based from our experience, given ICR's overheads to the local agency as it is and as it is required. And then equitable partnership. To us, partnership is equal contributions. Yeah, we can get funding from international organization, which will be directly given to us, and they expect our time, expertise. Locals actually is just as the name suggests, but we have a lot of expertise within our reach, because these expertise are locals. They have wealth of experience in terms of resource management, in terms of technical advice to the local actors, including women, youths, across the border, because we have no challenges crossing across the border. This is just a boundary line whereby an expert from a local organizations who engage locally because of his wealth of experience in the area can able cross and do a lot of good work to have the value for money. There's also simplifying the local audience and time-consuming due diligence process. For us, as a local partner, when we are engaging with international organizations, because of course the trend today is issue of consortium, which has really adversely affected the operation and delivery of the local partners, because one, you are clearly indicated in the call for proposals and any other funding opportunities that in a consortium, the lead consortium should be origin from the donor country, which wasn't fair to us totally. So in such scenario, you will find that what goes down to the local partners cannot even sustain them, but we do the donkey work. Yeah, the other things which I will clearly say to the international donors, funding partners, is that locals also has capacity. And in terms of documentation, based with my experience working with international organizations and also donor fundings from a bigger like EU and the rest, what I've realized, international organizations, yeah, they have expertise, they have good documentation, but all the dunk work is being done by the local actor. It's only the challenge we have is in terms of capacity, because we cannot, most of the local partners cannot document properly what they are really supposed to do because of their capacity. So here we need capacity strengthening, partnership with good relationship, funding capacity is all what we require. Thank you.
Very interesting. There was a lot of response, Don, to your quote, to make things as local as possible and as international as necessary. I think that really, I'm a sucker for a good slogan. That is such a rich point that you can take in a lot of different directions and unpack a lot out of. I really appreciate that. Your points about to get into the weeds on operational issues for a moment here, you made a really interesting point. Yusuf and Isaac got to this a little bit as well, about cost recovery and the ability for local organizations within the current sort of operational regime and compliance structure that exists in the development community. Local organizations often do not have the ability to capture an appropriate percentage to invest in themselves, to be able to develop a business development person who's not billable to a project, develop a CFO quality or a quality executive level financial manager and CFO, and to make the investments that may be necessary with just a de minimis or lower overhead structure for them. I want to open this question up to everybody. We've kind of gone through the panel with some specific voice questions here, but I want to open this up to whoever wants to unmute from our panel here and ask you, what approaches do your organizations have to dealing with the constraint in resources and making the most out of that? And I'm thinking maybe, Adan, you can start this from the community organization perspective, and Isaac and Yusuf can join in. Kelly talked a lot about grants programs, and maybe there's a piece of that is relevant here as well. But Adan may be having a connection issue there. So anybody who'd like to jump in on that question, how you've handled or how you advise organizations to handle resource constraints while also trying to grow and strengthen their organizations.
I'm back to Steve.
Please go ahead.
Yeah, your question about communities planning to become direct recipients.
Well, about handling resource constraints while still being, while still growing and strengthening your organization. What are some of the bootstrapping or other approaches that a community-based organization can take?
Good. What we are currently doing and implementing as a good practices is we have our own financial management system, whereby we have a financial management manual, which guide us in our operation of day-to-day to manage the available resources we have, depending on the budget line items. That is how we are still managing the resource at our disposal.
Stephen, you're on mute.
Thank you. Isaac, did you want to jump in on that point? I know you unmuted while I was still framing that question up.
Yes. Yeah. I think Edan makes a very good observation, and to borrow from him, and also what Dawood talked about in terms of local organizations. One of the things that we need to appreciate is that by the time they are being thought about and formed at that very local level, they know the issues. They actually know, if you ask them, they have an idea of what kind of expertise is required to address those issues. They even have an idea of a local solution. I know a local solution to that problem affecting that part. Now, the thing is, what needs to happen sometimes, and sometimes it could derail the vision of that local organization, is the person who has the funds. Because the person who has the funds also has a vision and a mission. So eventually, the organization starts getting converted, even when it is local. It loses that bit of being local. It starts implementing a vision, mission, not even of the community, but of the person with the fund. So if the organization had the capacity to at least push back a little, to say, hey, yeah, we like this, and we would want to work together, but can our partnership be meaningful? Being able to negotiate for that meaningful partnership, so that it's not one-sided. It would help, in now being able to identify what the issues that organization has and helping them to grow. For example, the length of a program. Sometimes you have good programs, which even include building the capacity of the local organization in areas where they need the capacity, but then it is so short-lived, 1 year, 2 years, 3 years, it's gone. Just before they would pick up, we should be able to negotiate or even structure and design such programs over a length of time, 5, 7, 10 years. Then you say there is a way to be able to ensure they've reached, maturity. When you look at sometimes the overheads that Edan talked about, sometimes a local organization does not have the capacity sometimes to negotiate a better, say, NICRA, for example, in case of USAID. Because you really need these resources so much that you don't have the capacity. They are where we go to negotiate and say, I think I need more than just the 10%. I think I need more than this. But for a global organization, it's very easy because they have that capacity to sit and say, hey, these are our operational costs. This is how we want to deliver. So somebody needs to be able to bridge the gap to enable them recover so that they can be stronger and sustainable, in the end. And then lastly, even the measures of success. I like the way I've seen funding evolve over my short life, from where we were being told these are the indicators, this is the budget, these are your targets, to where it has evolved to, okay, we could have this kind of money, but what kind of work would we do in this area? Say if it is family health, for example, or reproductive health, or animal health, depending on what it is, to how do we measure success? So that, again, as much as way back to what Edan said, so that whatever is local can now go to the international level. Sometimes we struggle too much to bringing the international to the local, and then you lose the local because the local becomes international and the local is lost. I don't know what I've said in that sentence, but making sure that we're able to make it fully inclusive, meaningful, participatory, especially for those small, local organizations. Otherwise, eventually what will happen is that the big organizations will morph into small organizations. And we've seen that happen. Nothing against it, but we've seen that happen a lot. Because we understand as a big organization how to be local, we localize ourselves, and then the local organizations again almost die actually, and something needs to be done about that if indeed we are true to our faith and believe that we want to localize. We really have to find those local organizations and build them, rather than convert the big organizations into local organizations. Thank you.
Yeah, Stephen, if I can come in there just to complement.
Please go ahead.
Yeah, the global, impetus to change the power dynamics and rethinking the entire philanthropy ecosystem and narrative has never been stronger. And this is the fact that the complexity of the modern crisis makes it really a reality for us to be able to review probably how we approach partnerships, how we approach localization, as well as how we approach the funding model. experiences and studies have also shown that local actors as well as local leaderships are the key to really addressing some of these issues, as well as the route to greater equity, effectiveness, and also getting impact on as a result of localization. As Isaac was mentioning, you know, there's potency and power in proximity. There's potency and power of impact when you know interventions are driven and led by local organizations. They have the expertise. Sometimes when we involve local actors, interventions can be timely, cost-effective, efficient, and impactful. We understand that they have the contextual knowledge, they have the networks, they have the political and cultural understanding in their context. That itself is a bonus for local organization. They have the expertise in so many ways, and they're able to come to the discussion table and discuss either with the donors or even other international organizations that are subcontracting some of these projects to be able to say, yes, I think we are coming with this expertise, and we need to be treated as equal partners, especially as you mentioned, having respectful and equitable partnership based on equity, based on complementarity, based on collaboration, mutual understanding, mutual responsibility, and accountability. So this will be very key. And I know there are a number of international organizations that have moved into local organization by virtue of the fact that they are international, but then they have converted themselves to local organizations, further perhaps killing or even derailing the opportunity for local actors to be able to get funding from donors. Then the other aspect is in terms of the policies and procedures. I think there's need for donors as well as international organizations that are providing funding to local actors to be able to be flexible and willing to accommodate. Sometimes, you know, one size fits all has been a bit of an issue. The contexts are different, capacities are different, and it's important for the donors and these other big organizations to be able to really accommodate and see where are the gaps, and even walk the extra mile in terms of when you bring a local organization on board, conducting the due diligence process, but identifying also the gaps and the needs and ensuring that they are supported to make sure that they're able to deliver this project. I think there's a lot of potential for local communities to be able to get these resources and the agencies to be able to resolve the problems that impact them.
Yeah, incredible. Listen, really excellent points. I want to recognize, Kelly, I'm going to circle back to you in a moment, but I want to recognize this is a panel of 183 people right now. There are some remarkable questions and points coming up in our chat, some of which the panelists are actually touching on because of some of the like-mindedness that I think and similar experience that we have across different organizations here. But those points about being inclusive, those points about the different opportunities and how the structure of the way development priorities are set and the way development dollars are distributed are being echoed by and built on by folks in the chat here. So if folks listening haven't been scrolling through that chat, and I think you have, because it's really been remarkably active. I want to turn us now toward health specifically and get into context a little bit about health. Kelly, you, in your opening statements, you talked a lot about thinking broadly about localization, and that there's a lot of different ways and entry points. I'm not sure if you use that phrase, I'm paraphrasing here, but different entry points to actualize and operationalize localization in different ways. You got into grants and a few other things. How do you think that this moment and this renewed focus on localization can really benefit healthcare and access to healthcare at the local level? What can be the benefits of increased local leadership, increased local priority setting, and increased dollars to local organizations in access to healthcare?
Great, thanks. That's a lot in one question.
It is.
But I will try to take some thoughts and really draw off some of the comments that my co-panelists have already made. And so I do appreciate the points that Isaac was making in his first remarks about really looking at the value for the health that you can achieve through $1 and focusing on the results. And I think especially when we're talking about donor agencies, I mean, my experience working in a donor agency is they are very focused on the results that can be achieved and the value for money. And I think it is incumbent on all of us to make that case. And I don't think it's a hard case to make, especially these days. We have seen tremendous progress in health around the world. There's a lot more to be done, but certainly mortality rates are lower than they were when I started. There's reduction. PEPFAR has been fabulous in terms of reducing HIV, TB, those kinds of things. But we saw with COVID that there's vulnerabilities in the health systems, and that they can be easily reversing some of the gains related to immunization rates or those kinds of things. And I think all of those points make the case for localization. So on the first side, the fact that we have achieved tremendous progress makes us stop to think, well, where have we not achieved progress? And that is the equity issue, and really some of the hardest to reach populations, some of the populations that have traditionally not had a strong voice. And really the way to give voice to those populations is through local organizations. They're in the communities, they're talking to people, they're from the communities, they know what they need, they know how they need it. And I think as international players, we need to recognize and understand that local solutions to these problems are the only way we're going to sort of reach that last mile on health solutions. And we have the way we're going to get value for money is by adapting and bringing best practices to, or understanding how local organizations are best placed to implement those practices. On the emergency side, I think we saw with COVID that when health systems start shutting down, it's the local communities that figure out the solutions, that figure out who's open, how do you get resources from one area to another. And I think the more that we can reinforce those plans, we can reinforce systems. So the more that communities are prepared and aren't sort of solving all of these problems on the fly in an emergency, but really thinking about emergencies and recognizing that there probably will be more infectious diseases. Certainly climate change and all of the impacts of that impact communities, and the more they can be prepared, the more they can help support access. So I do think that now is the time. I think that it's not just the localization moment, but it's that combined with where we as a community have come in the health space, where we see the current threats in health that really sort of make the case to say, if you want to achieve, donors, if you want to achieve results, if you want to achieve value for money, the way to do that is to understand how to achieve sustainability by working through local organizations, how to be more inclusive. And I think I saw a point in the comments earlier about the power that local organizations have when they can network together and provide capacity building amongst themselves and really sort of help to achieve some of those objectives. They can also advocate together for themselves to make sure that that sort of by functioning as one voice, they can really sort of make the case that they do provide value for money, do need to measure it, do need to make that case, but also that they're a lasting presence and are the solution to the problems that are still around.
Yeah, Stephen, if I can
Please
come
go
in.
ahead. Let me open that point up to others as well. The general question on how this moment and this initiative from donors can directly or indirectly, but can affect improved access to healthcare for people at community level.
Yeah, great.
Please,
Thanks.
Yusuf.
As Africa Human Capital Development, we are a very young and ambitious organization that's advocating for acceleration of human capital development results in Africa. We are continental, regional, as well as local. And one of the focus and thematic areas is health and health security. So we have realized that there's minimal growth and progress in the health sector, generally in Africa, because of perhaps inadequate funding, because we also have a growing population, plus other factors that have really impacted the indicators in this sector. You will realize that the reality in Africa is that we carry almost 25% of the global disease burden. I'll be specific to Africa, the fact that our organization works in Africa, and also looking at the health sector. And Africa also contributes just 3% of the global drug production, whereas we only manufacture probably 1% of that. But then we import drug worth or vaccines worth 14 billion annually for the continent. So this is an indication of perhaps the lack of access or capacity in the continent to be able to actually meet some of these needs. You will realize that according to the report recently released by World Health Organization in February this year, every 2 minutes, a woman dies during pregnancy or childbirth. 70% of these deaths occur in sub-Saharan Africa. So our question is, why is this? And I think it brings us to an element of access to healthcare, as has been posed by Stephen. And for me, when it comes to localization, this is a new vision for inclusive and sustainable development. By shifting power and resources to local actors to supplement national governments in terms of investment in building blocks of health system strengthening, whether primary healthcare, universal health coverage, and all that, ensures that when we combine national efforts and localization, basically the local actors, then we are bringing everybody to a seat. We are giving everyone a seat at the table. We are offering listening ear so that the voices of marginalized, those in hard-to-reach areas, are heard. So we are able to include even other members of the community, whether they are disabled, whether it is the youth, the women, LGBT, ethnic and religious minorities. All these will have a better say when we are able to really advocate for access to healthcare across the board, so that everyone is involved. We're able to set priorities, design activities together, do the implementation, and even measure and evaluate the results. So this is very, very important for me. There's an opportunity for governments to be able to really ensure there's access to health for everyone, but also there's an opportunity for the donors to be able to really broaden that and ensure that they're able to really bring more resources and funding, not only to government, but also local actors. For instance, like during the Grand Bargain in May 2016, there were lots of commitments that were made, probably providing 25% of humanitarian funding to local and national actors. And there has been another renewed commitment in 2010. A lot of other good commitments were made, where some of our donors have also pledged to provide 25% by 2025, then increasing that, especially USAID, to half, doubling that by 2030. But the reports also indicate that despite the potential for local and national actors to be able to really provide impact in these areas, organizations like African-led organizations, for example, have received less than 6% of all US fundings, US-based foundation fundings, and probably less than 1% of all international fundings. So there's need for us to really advocate and ensure that there's more funding going to local actors, given the fact that there's a lot of impact that they can make on the ground, and ensure that they're able, given their local and contextual understanding, that they're able to really address some of these gaps.
Yeah. That's wonderful. And it's helpful to have some of that statistical context that you're providing as well. Isaac and Adan, I would love for you to take a moment to respond on this point as well about localization and access to health services. I want to turn pretty soon here to some of the remarkable questions that are coming through as well. So maybe keep these comments short, and then we'll turn to some questions from our audience, okay? Isaac, and then Adan, if you don't mind.
Yeah, for me, I think that if we go through the local, and provide opportunities for local actors to define the problem, maybe with a little help to sharpen it, then to define the solution, and then where resources are being avail the resources to them. It's very possible to increase access, because also the local beneficiaries, the local communities are very able to hold those local actors accountable. Social accountability mechanisms are easy when you know who you're holding accountable, they are part of you, where. That will then increase confidence in the health health system, for example, and people will know that they are getting, what was promised and the value at which it was promised. So that then we make sure that from all what people are saying is that we are not localizing offices, and we are not we are localizing activity. We are localizing implementation. We are localizing results. Because like I went by saying, if we moved today the office of WTO to Nairobi, it wouldn't make WTO African or more Kenyan. It would still remain. So let's not do that. Let's clearly be sincere to the word as it is. Local, what it means. Then we work about building that local capacity, building that local partnership, building that local delivery, so that then over time we say that community has been able to get the capacity it requires, and it is committed to that cause, to deliver its own development. Thank you.
Yeah. I like that point, localizing the results. Adan, your thoughts on localization and access to health services?
Yeah, good. Actually, the access to health service, it has been already formally or informally localized based with our experience, because local system actors are there as community health, human health workers, community animal health workers, community disease reporters. A good example for localization is, you remember in 2020, there's outbreak of COVID-19. There was a lot of awareness creations, others using local medias, but it was very effective when the local system actors like community health workers have been used and the coverage was high. In Kenya right now, the good practices is that people have accepted the vaccinations because of the community health workers' efforts, community health extension workers. Now it is part of the routine immunization, because when people go for health services, they are jumped and they are accepted. So it has worked very well. What we need is strengthening of these community health institutions, closely working with relevant health departments, but huge chunk of awareness, the benefits from the health are being done as an extension methods for health, especially human health for the community. And it works better when it goes localizations and the provision of those professional advisors within the community.
Got it. Really helpful. I want to turn to some questions from the group, from the audience here now. Early on in our discussion, a listener, Kate Ramsey, came up with or put forward a really interesting question. How do we ensure that what is local and authentic about organizations is not lost when they learn or are required to comply with global requirements from donors, which can change the nature of an organization? I've seen this happen myself. Extremely unique organizations in Bangladesh. I worked with an organization that a clinic that was a legacy field hospital from their war for independence. Very unique, named for one of the heroes of the independence movement. It became part of the Smiling Sun franchise there. How do we help these organizations or make room for them to remain the unique and truly local and authentic organizations that they are, while they still can enter this space of accountable and compliant use of public dollars? Who would like to jump on that one?
Can make an attempt at that, Steve. And I'll go back to the point I raised earlier that localization does not mean making the local organization lose its identity, its focus, and its vision. Even if they were focused on that one small health.
Volume, my friend, volume.
Okay, yeah. So it's about making sure that we build on the existing. We don't throw away what is existing and then start developing something entirely new. Even technology, even innovation, whether it's tech innovation or social innovation, it builds on something. It builds on something. There's something discovered along that development pipeline. So if we are keen enough to do that, then we are going to localize very, very effectively. But if what we have is something we have in mind and we just want to transfer it to some place, then what we'll do is we'll just have changed the location of the action and the vision, the goal owner of the vision. But then the local vision gets lost. So it's about looking at the people, making sure what we are doing is people-centered to that local population, so that we build that, we nurture that, whatever it takes. And in many cases, we'll find that we are not beginning from scratch. We are building on some idea that is existing, a nascent idea, sometimes very novel, but what it requires is that next kick, that next injection, and it becomes the perfect solution, sustainable solution for that population. So I think that's where we should go. Otherwise, we will internationalize the local rather than localize the internationalization. Something around making sure that let it be the real local identity. Let's not, again, I will repeat, let's not localize physical presence. Let's localize what needs to be done. Let's localize who needs to do it with the help of everybody else.
Thank you, Isaac. Kelly, I want to circle back to you for this question. There was a point that donors need to tailor their terms for giving to local needs. That's quote unquote. We touched on this a little bit, but in your opinion, and the different ways that APT, thanks for putting that resource from APT Associates in the chat, by the way. What are the key changes, Kelly, that you think donors need to make in order for greater leadership from local organizations to be a reality? How do they create space within their need for compliance, as well as their need for, as you said earlier, driving results?
Thanks. I think part of it is the shifting mindset that we're all working on, and really taking some self-reflection and understanding what is the role of global donors. And I think it's to provide, it's to help enable access to resources, and it's to facilitate and grow local expertise that can be sustainable. It is not to come in with all the solutions and all the ideas. So it's really sort of understanding from global partners' perspective, what is our role? And the role is, like I said, it's to be facilitative, to act as a connector, to be able to support local organizations to draw out their resources, their expertise, their needs, to help advocate for what is needed, and to approach efforts with some humility, I think, and understanding that we don't always have all the solutions. I think one of the interesting sort of paradoxes in the health space is you'll find a ton of research on great programs that have been immensely effective in one country or another, and then when you try to take that program and apply it in a different context in a different country, it's not always as successful as it originally was. And I think there was a question in the chat earlier about systems thinking, and I think some of that has to do with understanding the local context, the local players, and understanding how to adapt what you understand is a best practice or a proven approach, but recognizing that you can't just take that approach and apply it everywhere. And you really need to figure out how to adapt and understand. And so again, it's not coming in as an expert with all of the answers, but coming in and being able to say, well, we have experience across a broad range of countries. We've seen things that work, but we need to work with and through local organizations to understand how to take things that have worked or knowledge that has been generated in other places and adapt and adjust it to achieve, again, that value for money and really to make that case. And so I think donors and global organizations need to approach efforts with that humility, where the role is as a connector, the role is as a facilitator, but not as a sort of know-it-all expert.
Yeah. Well, I love that point about humility and not pretending. USAID has shifted a greater percentage of its funding to open innovation modalities of procurement, and that itself is a procurement admission that they don't have all of the answers in their design, and they want to open design and solution up to different organizations. Now, humility is an attitudinal issue that I think we would all love to see institutions capable of practicing. It's difficult when you're the world's largest bilateral donor, or any large donor for that matter. And it's something that I think is difficult to probably measure. The next question is, and to try and keep people accountable to, in some respects, is their attitude while trying to have results. How should we measure the success of localization? Whose metrics are most important? How can local communities, as well as local organizations, be involved or even drive the metrics that are selected to measure the success of localization? And let Adan circle back on this one and get us started. And then if others have thoughts about that, because I know others have gotten close to this topic already in some of their previous comments. Adan, go ahead.
Yep. Actually, the success of measuring localization, one is about the shifting of the power. If the international organizations directly give funds to local organizations and they do their operation well, that is one. Secondly, issue of risk transfer, because once the international organizations give funding to the local partners, they start due diligence assessments. Once already they have been given the funding, after they go under the due diligence assessments,
Don, you froze up on us there. Let's give it another second to see if he comes back. Okay.
and the assessment
you are.
called actors relations in a common review process for local actors, and of course, including the minimum arrangements of the assessments conducted by one of the donors and accepted. Those are also the success we can measure, and the type of the outputs after the resource has been delivered. Thank you.
Isaac, you want to comment on this one?
Yes. I think as we go through all this, I know reading about everybody, because it's not only USAID who is talking about localization. Everybody is talking about localization in a different way. I think it's high time, if we want to go through this, where we also have some localization metrics that we all accept and subscribe to. It's not just about the dollar transfer. It's not just about the number of organizations that have been funded locally. It's a little bit more. It's a little bit more than that. I want to know what kind of impact is being realized by the local organizations. What kind of results are we achieving? What is our reach? And so on and so forth. And even the cost. How are we changing even the cost of delivery and all that? So there needs to be something to be able to measure localization over and beyond the optics, over and beyond what we see in terms of money has gone to AMREF or money has gone to the other partner. We need to go beyond that for us to be able to say, yes, we have achieved localization. And then there is also localization from the eyes of the beneficiary. I think somebody also needs to engage the beneficiary in terms of how they perceive certain things, how they perceive quality, how they perceive access, how they perceive equity, in terms of who is actually coming to deliver, a development agenda, or help them achieve a development agenda in their communities.
Yeah.
So it's a little bit broader, and I think it's something that we all need to work on cooperatively, and I'm sure it's going to help us achieve this broader objective of localization.
And I think sorry, if I could
Please.
jump in really quickly, just
Yeah.
to add, I think we also need to expand our view of metrics and recognize that there's lots of really robust qualitative methodologies that can capture some of the nuance and how we can couple some quantitative metrics, which a lot of times are too blunt of an instrument, with qualitative, rigorous data that really does tell the story of localization, and really recognizing that not all good data is quantitative.
Well, as we said before, Isaac's already got us started on a toolkit from earlier. We can add this as the measurement annex here. Dr. Youssef, I want to turn to you for a moment and building on some of Isaac's points and some of the other points said earlier about diversity and being inclusive here. There was a question from an audience member about diversity of thought in localization discussion and how we make sure that marginalized communities, whether that's ethnic, that's gender identity, that could be women, that could be the whole range of different marginalized communities, how their voice is channeled and incorporated or directly heard, both by donors when designing and walking forward in their localization agenda, but also by local organizations, international organizations, the cross-section that we have here. What are some thoughts about ensuring marginalized communities can be heard and are included in this moment and initiative to localize?
Thank you, Stephen. Before I respond to you, just a very quick addition to a point on
Sure.
On what my colleagues have said. I think the localization approach has the transformative potential to really change the humanitarian sector. And I think there is some national and local organizations that are currently working on localization performance measurement framework. And I think it goes beyond just funding, the amount of funding that goes to local actors, but also looked at what kind of communities we are reaching, the impact we are making, and a lot of others. I think it is still work in progress, and at some point probably we should be able to have a major measurement framework that can guide what success looks like for localization. Coming to your point, I think in terms of diversity, equity, and inclusion, when we talk about localization and putting, the locals, the local actors and leadership at the center of interventions, we are talking about people who already know the local context. And if we are able to invest in funding, leadership, providing resources to a local organization, what that means is that they have a good understanding of that area, including who are the communities that were affected, what sections of that community are affected, are they marginalized, are they hard to reach, are they disabled people, are they youth, are they women, are they LGBTs, are they religious minority groups? So I think what it means is that if we are able to work with locals in an area, it means these are people who really understand that context, and they're able to bring the diversity of opinions, but also the diversity of the groups into the conversation. And by doing so, you'll be able to identify the needs of each of those groups. And by designing your project, you're able to actually say, okay, we have this group, we have that other group, what are their needs? During the project design, during implementation, and even measurement and evaluation of projects and results. So I think that is how I look at it. And I think the element of diversity, equity, and inclusion will be very key as we discuss localization efforts.
Wonderful. Thank you all so much. This has been remarkable, incredible participation from the audience here as well. I'm going to spend the next couple of days reading through this chat and learning even more. I want to bring Lisa Hilme back to the mic. Lisa, I would love for you to comment for a moment on how Core Group as an organization and as a network can support some of the things that we've talked about here today in terms of all of the different ways to actualize localization and to make sure that local organizations can be aware, better heard, et cetera. Please, your thoughts on that and how Core Group can be an important part of that.
No, thank you very much. And this has been a really riveting conversation. I've been copying some of these phrases and throwing them out there on social media. So thank you, and look for that. I think some of it we are doing and some of it we are learning from our local members and partners. On some USAID grants, we want to do subcontracts with our local partners at the country level. And so instead of hiring international consultants to swoop in and do local work, we actually hire the people that are at the country level and give them those economic opportunities, as well as the capacity building, the exposure, and the voice. I think on other small grants programs that we have, a lot of what's been said today around the capacity building and organizational assessment, we build that into our grants. And when we've worked with a certain family foundation, we insisted that we're not just going to give technical grants, we're going to also work with what organizations want from an organizational strengthening point of view. So it's more sustainable and really advocate for something besides $5,000, that the amount that is given to local organizations for grants is something meaningful that they can do work with, and that there is trust-based philanthropy here. As a membership organization, I think the connections that are being made, not only for mentorship and mentee bi-directional capacity building and sharing is already going on, and there's lots more for growth. We also are holding regional conferences and regional events where people can be convened and have these types of discussions on a regular basis, as well as our local, our staff that are based all around the world. I think we have about 70% of our staff that are in non-US countries to lead programs, to rally a lot of our membership. There are opportunities for leadership in our working groups. We have 9 working groups that are thematic across the global health technical area, and they collaborate. So those leadership opportunities are also available for our members. And you can learn more about Core Group on our website on coregroup.org, and we welcome all of you to join as members to help advance some of these conversations. And then lastly, I'd say we work with donors very closely to make sure that the opinions that have been expressed here today, the recommendations, that they actually get back to donors, whether it be USAID, family philanthropies, or others that reach out to us. We create those opportunities, whether it be town halls with Dr. Atul Gawande, or whether it be consultations on different strategies, as well as recommendations for our local partners and local members at the country level to advance for some funding, and that we recommend them. It doesn't have to come through us, we recommend them. So there's lots of different opportunities that we hope to offer and expand, and we look forward to hear also what you want, because in our strategy process, it was based on what our members and what our partners and stakeholders said.
Wonderful. There definitely are a lot of different opportunities for organizations to connect and become engaged and involved with each other. Certainly what drew me to Core Group and my organization, DAI, to Core Group as well. So thank you for that. Definitely, Lisa has put links into the chat in several different places, and Lydia just dropped the name and email for our membership manager, Arafat Safi, into the chat. I want to thank our panelists, Yusuf, Adan, Isaac, and Kelly, so much for your thoughts and your time and perspective here. Very generous. I want to thank all of the audience for what is still an active discussion going on. I think we're going to try and comb out. We didn't get nearly to all the questions, and there were some excellent questions that we could put another 2 hours in here, but I think we're going to try and comb those out and put out at least a blog post or something where we can put some of those questions out. Maybe some of our panelists are willing to type up some responses to some of that in the future. So I'll talk with Lisa and Caroline and Lydia about that and figure out what's possible as a follow-up to all of this. But thank you to Caroline Quijada for curating questions, and to Lisa for the same, and just her unwavering leadership at Core Group. Thank you to Lydia for being great behind the scenes production on this, and all of you for joining. Have a great afternoon. Keep doing great, impactful work, and we'll see you again for another opportunity to share perspective in the future.
Thank you, Stephen.
All right.
Bye.
Be well.
Okay, thank you. Bye bye.
Thank you.
Excellent job moderating, as well as our panelists. Thanks so much.
Thank you.
Thank you.